Welcome back. In your morning medical news, major changes ahead for some weight loss medications. The Biden administration plans to expand Medicare and Medicaid coverage for those obesity drugs, including GLP-1 treatments. So for some patients, costs could drop by as much as 95%. The proposed plan's price tag is $35 billion over the next 9 years, though key details like eligibility and timing still need to be worked out. Heart disease risk factors may impact men's brains earlier than women's. A new study finds men could develop dementia up to a decade sooner. The research points to factors like obesity, diabetes, and smoking affecting brain volume, with men becoming vulnerable at 55, while women's risk increases at 65. Women who have severe complications during a first pregnancy are less likely to have more babies. That is according to a new study from Sweden, where researchers looked at more than 1 million women with new babies over more than a 20-year period. They found 3.5% of new moms had serious complications and were 12% less likely to have another child. Women who had heart problems, a ruptured uterus, or mental health issues were 50% less likely to have more children. Home testing kits can substantially increase screening for colorectal cancer. New research from the University of North Carolina looked at about 4,000 adults with average risk, and they found those who received the at-home collection kits were 3 times more likely to be screened within 6 months. A positive result on the home test indicates trace amounts of blood in the stool, which is an early sign of cancer. A Texas family is grateful this Thanksgiving. A 12-year-old girl saved her younger sister's life just hours after learning basic life-saving skills in a class. J.D. Miles has that story.
It was a normal day for 12-year-old Ari Agramont and her sister Suri. They were preparing to walk their dogs when the 8-year-old started choking.
She leaned back to take a deep breath, and she did the motions cough down, but no air was coming out, so I got scared. I didn't know what was happening.
Suri had a piece of candy stuck in her throat, unable to breathe.
So I was just pressing against, and then I did it once, just pressing against, and then I remembered to scoop, and I did it twice, and that the third time it came out.
Ari applied the Heimlich maneuver on Suri.
I was like, oh my gosh, she actually could have died.
And possibly saved her sister's life. It's a skill that she had learned only hours earlier in a babysitting training class sponsored by the McKinney Fire Department with help from Baylor Scott and White nurses.
I've been wanting to babysit, but I kind of wanted to find a reason for parents to trust me with their kids. So my aunt saw that class and recommended it to my mom.
You should be so proud.
McKinney's mayor and city council honored Ari with an award in front of her proud parents.
Even though if you do have that training, not everybody has that ability to just stay calm and react and do something. So we are very proud of you because you did it.
When she was describing the technique that she was using, she described it exactly the way we teach it. So she's paying attention, which is great.
McKinney Fire Chief Paul Dow says what happened illustrates why basic life-saving skills are important for everyone to learn. 2 young girls can continue to grow up together, all because one of them knew what to do in an emergency.
So important. The class also teaches other skills like hands-on CPR and basic first aid.